Okay, guys, the focus of this lecture will be present the radicular arteries and also the veins of the spinal cord. Now, starting with the radicular arteries, well, the radicular arteries, this part here, are branches that enters the vertebral canal through the intervertebral foramina. And let me just okay. And what you will see here is that they run along the ventral and the dorsal roots of the spinal nerves, supplying blood to the spinal cord as they accompany these nerve roots. And one of these radicular arteries is particularly large and is known as the artery of Adam-Kiewitz. I'm not sure if I pronounced it correctly. And this artery is crucial because it supplies the major blood supply to the lower part of the spinal cord. Okay, so let me just finish this. And the radicular arteries will play a vital role in the vascular supply of the spinal cord, especially in regions where the anterior and the posterior spinal arteries may be insufficient. And if you understand this and their anatomy and also the clinical significance, you will have a better idea of how to manage conditions affecting the spinal cord, especially if you work in the medical field. This artery that I mentioned, the Adam-Kiewitz, is a prominent radicular artery that typically arises from the thoracic or upper lumbar region, T9, L2, and supplies the majority of the blood of the lower 2/3 of the spinal cord. Okay, which is this one. Okay, this one right here. And some in anatomy we refer to this artery as the artery of life for the spinal cord because its occlusion can lead to severe ischemic damage, and especially in the lumbar and the sacral segments. Now talking about spinal cord ischemia, what happened is when this artery here, Adam-Kiewitz, let me just write because I think that will be better. So Adam occlusion or compression of this artery usually results in acute spinal cord ischemia, and even the patient might even present symptoms like a paraplegia, sensory loss, or autonomic dysfunction. So this is the artery, Kiewitz. In Portuguese, I think that we would pronounce Kiewitz. Okay, but I'm not sure how they pronounce in English, to be honest. And so what happened is during in case of spinal surgeries, what will happen is the surgeon will identify and preserve this artery because he or she probably knows very well how critical can be the damage on this artery in specific. Okay. Now, about the radicular arteries and collateral circulation, basically the radicular arteries will provide collateral circulation to the spinal cord, as I mentioned before, and this ensures redundancy in blood flow. Particularly, it is particularly important in case where the anterior and posterior spinal arteries are compromised. Anterior and posterior arteries, okay? Anterior and posterior. Now, the location, especially the location of the Aidan cuvets, can vary among individuals, ranging from T8 to L4, and this variability makes preoperative identification challenge, but it's crucial. Okay, it is highly important. And I would say that failing to identify the artery of Aidan cuvets during surgery, even not being a surgeon, can lead to inadvertent ligation or compression, which can result in catastrophic spinal cord ischemia. Now we have here the veins of the spinal cord, okay? These are the veins of the spinal cord. We have here a chain. Let me see if I can write with this one. This is a chain along the posterior median sulcus. A chain along the posterior median sulcus and along the, I'm gonna abbreviate, posterior median sulcus. Okay, we have this one, a chain along the dorsal root. Along the dorsal root. And then we have here a chain along the ventral root. Ventral root. And we also have here a chain along the anterior median fissure. Where I'm going to write this. A chain along the anterior fissure. Okay, anterior median fissure. This here. Okay. So, of course, that will be on each side. This one here, this one also here. And these veins will communicate with the internal vertebral plexus of veins and the durovenous sinuses inside the skull. Now, about venous drainage pathways. So, internal vertebral plexus. So, the veins of the spinal cord used to drain into the internal vertebral plexus, which ultimately empties into the vertebral venous plexus. And the system lacks valves allowing bidirectional flow. Okay. Communication with the dural sinuses. So when you talk about the internal vertebral plexus, it's important to understand that it communicates with the dural venous sinuses, facilitating the exchange of cerebrospinal fluid and venous blood between the spinal cord and brain. And yeah, so just to wrap up, the radicular arteries, including the artery of Aidan cuvets, are important for supplying blood to the spinal cord, particularly the lower segments. And their anatomical variability and clinical importance make them, in specific, a focal point in managing spinal cord ischemia and surgical interventions. And similarly, the veins of the spinal cord, forms a complex network that drains into the vertebral venous plexus and dural sinuses, which will play a key role in maintaining spinal cord health and function. And disruptions either in arterial or venous circulation will, in most of the time, lead to serious neurological complications, emphasizing the need for thorough understanding and careful management. So this is what I want to share with you this morning, and I hope you can get some valuable information about this topic, and I will see you next time.